Welcome to the Cardiovascular Pulse, where we dive into medical breakthroughs, leading technology, and healthy lifestyles. Join us as we empower you on your journey to a healthier and stronger you.
Hi listeners, today we're breaking down what's safe, what's risky, and what your heart really wants to know. Joining me today is Dr. Ahmad Jabbar, interventional cardiologist at Cardiovascular Institute of the South on the West Bank in Thibodaux, Louisiana. Thank you for being here with us today, Dr. Jabbar.
Thank you for having me. I appreciate being here with you and with our listeners and our viewers. Looking forward to this conversation.
Absolutely. Today we are breaking down some facts versus fictions and maybe some myth busting too. So first off, I think we're going to start with some beverages, maybe some caffeine. Going off first, is it okay to have coffee?
So, I love the question, is it okay? And the reason why I address a lot of those questions in that way before I answer your question is because a lot of times patients ask questions and they don't really ask what questions they are really worried about, right? And so we tend to address things in a very formal fashion, but in reality, sometimes there are things that people want to know as simple as, it's not about, well, is this deadly or is this going to give me heart disease? People just want to know, is it simply okay, right?
Right.
Because I don't do this every day, or I may do this every day.
You just don't know.
And I don't know what are the risks, are there benefits, are there no benefits, are there some risks? So the question, when it's asked in that way, makes it a lot easier to have these kinds of conversations.
Definitely.
So, to answer your question, when it comes to caffeine isn't necessarily harmful, right? It may be beneficial, especially if you take a certain amount of it and you don't overdo it. If you look at some of the studies that have been conducted over several decades, when you're looking at caffeine, the ideal amount is roughly around 200 milligrams a day, roughly. Now, where's that coming from? And the source is really what could be the problem. Right. So if you're drinking something like black coffee or maybe even tea, then there aren't many drawbacks, right? There's not much that could be harmful unless you start doing things like adding sugar, right? So having a latte on a daily basis with 200 milligrams of carbohydrates or a bunch of sugar in it versus having just a cup of black coffee that doesn't have many carbohydrates, doesn't have really much of anything else other than that caffeine, less likely to be a problem for you long term. Versus drinking something like a energy drink, which has probably way more than 200 milligrams of caffeine oftentimes, also has added sugar, and sometimes even has secret ingredients that you may not be familiar with or may not even be regulated. So, is it okay to have caffeine? Yes, it's okay, depending on the amount and the source that it's coming from.
Right. So generally it's okay as long as you stay within a certain limit of it. And that goes for the energy drinks too, like you mentioned. It's okay as long as you stay within a certain limit.
So I'm not a big fan of energy drinks because a lot of them have other ingredients that may not necessarily be beneficial. Right. So it's okay, maybe if you have them every once in a while, but I'll tell you, if you're drinking an energy drink that has 300 to 400 milligrams of caffeine every day, it's probably not beneficial. Right. Is it going to be harmful? There's nothing to say that it's going to be harmful. Now, we do know that based on some of the studies that have been conducted, if you have high caffeine intake and you do it on a daily basis, you may experience certain things and there might be some symptoms like palpitations, for example, that you will experience on a regular basis. So, is that okay? Do you like having palpitations? I don't. So, you have to really look into what you're doing and how it's affecting you.
So Dr. Jabbar, going along the lines of caffeine intake every day, there's some people who may take pre-workout every day. Is that okay to do?
So pre-workout is a little bit different, right? So it may have caffeine in it,
Right.
and most people take pre-workout for exercising, right? They take it so that it can give them energy and strength, and it help enhance their ability to exercise and do things like weightlifting or power running, or they want to improve their agility and their endurance.
Right.
And although it may have caffeine in it, and that's one element, it may have other types of supplements and other nutrients that are supposed to help improve those functions. The thing about pre-workout is there are lots of different formulas out there. So for me to say, to just give you a blanket statement of whether it's okay or not, it depends. It really depends on, number one, what your formula is, and number two, what your overall health is. What oftentimes happens is that someone assumes that, hey, I'm healthy, I should be able to take this with no problems.
Right.
And that may be the case, but if you have things like high blood pressure, if you're a diabetic, the pre-workout or whatever you're consuming may affect those problems that you have. So my suggestion is that you should always err on the side of caution and just talk to your doctor, whether it's your primary care doctor or your cardiologist, about whether the formula you're using is right for you, right?
Right.
Because let's just take high blood pressure, for example. If you have high blood pressure, we know that people with high blood pressure are more susceptible to having increase in their blood pressure if they consume a lot of sodium or sodium containing products. So if the formula you're using for pre-workout has things like sodium and other parameter or other nutrients that may impact your sodium health, guess what? It might increase your blood pressure. And long term, that might not be good for your heart.
Right.
So things to consider. Diabetics. Some of these pre-workouts have things that help enhance taste. So if it's got a lot of sugar in it and you're a diabetic, that could affect your sugar health, right? And that can have a negative impact on you. Again, that's not to say that all pre-workouts are bad, but I would definitely make sure you understand what formula you are taking and what is in there. And the other thing to be careful about is sometimes there are hidden ingredients that you don't really understand in some of these pre-workouts.
Right. So it's really about being in tune with yourself, your health, picking a particular pre-workout and knowing your baseline, knowing what your health is into these things. That's very important to know. And with all these topics combined, is there any benefit to having caffeine?
So caffeine isn't necessarily a bad thing. It's actually something that if taken properly and used properly could have some really good benefits. It improves your alertness, right? It's supposed to help with cognition. And there are some studies showing that a certain amount of caffeine, if a reasonable dose, can actually improve blood flow, right? And so if you look at some of the basic studies in terms of lab studies that are done, caffeine can be beneficial at certain doses. So it's not necessarily a negative thing.
That's good to know.
Yeah, no, for sure. I mean, I drink coffee every morning and
Right.
I need it to wake up. So it definitely helps you. It definitely helps you with being alert. It helps
Focus levels.
focusing.
That's incredible to know.
And being able to get things done, right? So
Right.
there's definitely some benefits to it.
Definitely, which I hadn't known before either. The limits are very important there, I can imagine, with it. Sure. And along the lines of beverages, is it okay to have alcoholic beverages?
So personally, I don't drink, and I tell my patients, if you don't have to drink, don't drink, because if you look across the board, the risks that come with alcohol are way more than the benefits. And frankly, if you listen to a lot of these people now who are focusing on longevity, a lot of people coming out really talking about the negative impacts of alcohol, we've known for a long time there are a lot of negative impacts from alcohol. Right?
Absolutely.
And so if you want to drink, that's fine. But if you're really thinking about long-term health, there are a lot of negative things that come from alcohol. Now just talking about cardiovascular health alone, we know alcohol for a fact increases things like atrial fibrillation or irregular heartbeats. So similar to what we were talking about earlier, that is a known risk. So just know that the more you drink, the more that risk increases. Too much alcohol can actually lead to one of the things that we treat on a regular basis, which is a cardiomyopathy. So cardiomyopathy is when the heart muscle is damaged or becomes stiffened or weakened and leads to something called congestive heart failure. Alcohol is specifically tied, excess alcohol intake is specifically tied to something called a dilated cardiomyopathy. So yes, it can be dangerous. Now, am I saying, hey, don't go and drink? Personally, if you can avoid drinking and you can live without drinking, your body will thank you. But again, moderation for everything.
Yeah, right. Moderation for everything, knowing those limits with caffeine, with alcohol. It's okay to have everything with the moderation, but knowing your limits is very important. And your personal health, as you're saying, you know.
Understanding where you are, right? What's your baseline? What kind of risks do you have? And how do the things you consume affect your long-term health? I think it's very important to understand that, right?
Right.
So if you're someone that has atrial fibrillation, for example, or you're someone who has congestive heart failure, you may want to reconsider some of these things, right? And how they can impact you.
Right.
And so that's, I think, really, really important.
So going along the lines of everybody's personal health and tailoring everything that you do to your own needs, so can stress actually damage the heart?
Yes, it can. And unfortunately, I find that people don't recognize how much stress can affect your overall health, right? You know what we say, the brain is a powerful thing, right? The mind is a powerful thing. And so there is such a thing as a connection between the brain and the heart, the brain and the gut, and the brain and the rest of the body, right? They're very closely tied to each other. And so stress can be a good thing, right, when necessary. But too much stress can be very bad for the body. The stress response, for example, or what we call the fight or flight response, it's natural. You're supposed to be able to take advantage of that naturally in order to live and survive. It is a part of who we are. But if too much of that is going on, your body can get very confused and it can have a negative impact on multiple parts of your body. One of the things that can actually be very deadly is called a stress-induced cardiomyopathy. Rare, yet is very rare, but is really truly something that exists. And what this is that someone can actually have a heart attack or can develop congestive heart failure from stress. It's often coined the term broken heart syndrome, right? So someone has a very stressful experience or they go through something very stressful in their life, and that surge of that stress response can have a very negative impact on your heart and cause damage to your heart. And so that just goes to show you how dangerous stress can be on the body, right? And that's a rare situation and that's an extreme situation. But as you can imagine, someone with a constant stress
it builds up over time.
Can really have a negative impact. I've seen patients in my clinic who've had elevated blood pressure just simply from stress.
That's true. That
right?
ties in.
So stress can be very, very dangerous on the body. It can definitely have an impact on you, and it can be very, very impactful in terms of your heart health overall. So yes, it is. You're spot on with that.
Absolutely. And another thing that stress could induce most of the time is lack of sleep.
Yes.
And lack of sleep in itself, could that cause cardiovascular issues?
So lack of sleep, again, leads to stress, or stress can lead to, it could be, vice versa. And I mean, it could be like a constant cycle, essentially. your body needs rest. There's no doubt about it. You need to be able to shut down, unwind, and allow your body to recuperate, because I know, frankly, all of us have busy lives. There's a lot going on a day-to-day basis, and so your body needs that time to rest. And lack of sleep can actually be very dangerous for you. One of the common things, and the reason why we know lack of sleep is dangerous from a cardiovascular standpoint, we know that people who have things like sleep apnea, right? That's when someone's sleep is disrupted by their inability to breathe properly. Studies have shown that patients who have sleep apnea have negative long-term impacts on their cardiovascular health. Things like being at risk for congestive heart failure, being at risk for something called pulmonary hypertension, which is elevated pressure in your pulmonary vessels. That can have a negative impact on the right side of your heart and put you at risk for something called congestive heart failure. All closely tied to each other, right? Patients who don't sleep well or have a constant lack of sleep can have an increased high blood pressure at baseline, right?
Right.
When you compare someone who slept 8 hours a day versus someone who slept 6 hours a day, there are some studies that show that those patients tend to have a slightly elevated blood pressure compared to their counterparts.
Wow.
So that's just one example right there.
Right there, how they both tie into each other: stress, sleep, everything that can affect your cardiovascular system.
Yeah.
And going along the effects of the cardiovascular system, sometimes people might feel their heart skip a beat or palpitations. Is that normal?
Is it okay, right?
Is it okay?
This is the question. This is why I asked the question in that way. Is it okay to feel palpitations? If I got a penny, not a dollar, a penny for every time I get asked that question, I probably would be really, really rich. But again, all jokes aside, it's probably okay most of the time. Palpitations are just a sensation, right? It is a feeling. We use that term very loosely, but the feeling of your heart skipping a beat sometimes, or the feeling of your heart racing, or the feeling of your heart pounding across your chest is often what we are describing when we say palpitations.
Right.
And most of the time, it's probably nothing to worry about. But it sometimes can be something concerning. Now, if you feel palpitations, I would first suggest that you talk to your doctor about it, number one. Number two, if you feel it and it's infrequent and it's really not limiting your ability to do things, I like to give people reassurance by saying it's probably nothing, but it's always safer to be precautious and checking and making sure. So what are some common things that can cause palpitations? Something like what we call a PVC, or a preventricular contraction, premature ventricular contraction. That can happen for various reasons. Going back to our caffeine, drinking coffee or caffeine can induce these extra heartbeats. Most of the time is not dangerous and it's not something to worry about. But if they happen enough and they happen a lot, they may have a negative impact on your cardiovascular health long term, which is why I suggest you have this conversation with your physician to better understand your symptoms and how often they are actually happening.
Right.
So yeah, is it okay? Probably, but you want to make sure you get it checked out to make sure it's not something dangerous.
Right. And another thing that a lot of people might, fret over or maybe look into getting checked out are varicose and spider veins, maybe even just visible veins. Is that okay?
So why do people have varicose veins and why do they develop spider veins? There's lots of reasons. And most of the time, is it okay to have them? More than likely, for most people, it's completely fine. It doesn't have a negative impact on your overall health. But in some people, it could be a sign of something else. People develop varicose veins most of the time because of genetic reasons, right? They get inheritance of these bad genes that lead to their veins, which, just to remind everyone, if they aren't aware, your veins are the vessels or the kind of the conduits that allow blood back to your heart. versus your arteries, which your heart pumps blood into your arteries to get blood to the rest of the body. So once the body consumes what it needs to consume, like the oxygen and the nutrients from the bloodstream, it returns that blood to the heart to recycle. So the veins, I like to say, are like a drainage system. They're drains. And our veins, because they are drains, things move very slow in drains, just like any other drain, right? If you think about it. And so we have these check valves that are naturally in place to allow the blood to move in the direction that it's supposed to move to, towards the heart. So if you think about the blood moving in your legs, it's moving upwards against gravity. Right. So those check valves are important and necessary to allow that blood to move against gravity and back towards the heart. Well, imagine over time, those check valves get overwhelmed for various reasons. One of those things being genetics, but occupation plays a huge role. So someone who tends to stand all day or sit for long hours, they're not moving much, and so they're not pushing the blood past those valves as efficiently, and those valves get stretched and they get more and more tired over time. They lose their ability to kind of push that blood efficiently, and that's what leads to blood pooling and backing up and creating varicose veins. So varicose veins are just an indication of something bigger called venous insufficiency. Most people can get by without any issues because it ends up being cosmetic more than anything else. But for a lot of people, it can lead to lots of problems. Swelling, pain, heaviness, aching, and sometimes it can actually lead to skin breakdown and possibly even wounds and ulcers. So you want to be very, very careful depending on how bad those varicose veins are or how bad the venous insufficiency is. Again, you want to talk to your doctor about your specific situation. Generalized blanket statements about whether something is okay or not may not apply to you specifically in your situation.
Absolutely, absolutely. And is there anything like that of the sort that people may not know or that they need to know? Any kind of myth, fact, fiction?
So I think there's lots of things that people talk about or that they Google or they search or that they may hear and say, oh my God, I have a problem. One of those things that is very common and I hear all the time is when I ask a patient if they have any heart problems, they say, yes, I was born with a heart problem. And I'm like, well, what is that? Oh, I have a murmur. A lot of people think that a murmur is a heart problem. A murmur is just simply a sound that we hear when we're listening to your heart that some of your valves make when they're opening and closing. So when the heart is pumping blood from one chamber to another, that blood is going through a valve or different valves. We have 4 major valves in our heart between different parts of the heart, between the heart chambers and between the heart and the major vessels. Well, if there are any problems with those valves, it can create a whooshing sound called a murmur. Now, having a murmur doesn't mean you actually have a problem, right? And so I say that because a lot of people assume that that murmur means they have a heart problem. That's not always the case.
Wow.
So just something to kind of keep in mind. Make sure if you are someone who's been told you have a murmur, understand what that murmur actually is and why you have it. Because a lot of times you may have a murmur and it may be completely normal. For example, young kids may have a murmur or the sound of a murmur if they're anemic because of how much blood flow is going through the heart. Because of your anemia, that increased blood flow can make that whooshing sound. Or, for example, if you have a fever, we know when someone has a fever, there's more blood circulating, your heart rate's elevated, your pressure's changing. That can also cause an innocent murmur sound. So it's not always a problem and it's not always a bad thing.
Wow, it's not always. And I guess that goes back to being proactive about your individual health specifically. Everything's different for each person.
Yes, it is. And I tell people all the time, it's great to look stuff up. It's great to advocate and educate yourself. But don't always assume that what you're seeing or reading necessarily applies to you. Make sure that you individualize your care and you discuss everything with your physicians to make sure you get the proper care and you understand your problems specifically, or you understand what is actually okay for you.
Well, thank you for being here with us today, Dr. Jabbar. We certainly learned what's safe, what's risky, and what your heart really wants to know.
Thank you for having me. Looking forward to having this conversation again in the future.
We hope that this has empowered you on your health journey. If you have health concerns, visit cardio.com to learn more or request an appointment. Make sure to follow this podcast as well as CIS on social media for updates. Thanks for listening.